Hello, we are nursing students from Middle Georgia State College. My name is Drew McKelvin.
And I'm Courtney Bobbitt.
And I'm Benjamin Allen. And together we did Danny Ellington, Musculoskeletal. So we've just received Danny Ellington, 17-year-old black male, from the emergency department with a medical diagnosis of an open fracture of the right femur shaft with a large skin wound. He also came to us with a closed right Colles fracture. And a Colles fracture involves a break at the radius of the epiphysis within 1 inch of the wrist joint. He's been placed on a balanced skeletal traction with a Thomas splint to his right leg. He also has a cast on his right arm from the fingers to the elbow. To the MAR, we have that he is on D5W, or dextrose 5% in water, at 50 milliliters per hour. He's also on Vicodin, extended tablets. 2 of those he'll be taking every 4 hours, PRN for pain. He's also on Ancef, which is an antibiotic, 1 gram IV piggyback, and that's every 6 hours.
Alright, so Danny was brought to us with an open femur fracture with a dirty wound. So he's at risk for infection, and we need to check if he has had his tetanus shot recently. He had it when he was 14 years old, which was 3 years ago, so he's good for that. Then we want to take our priority assessment, which is vital signs. One of the things you want to look at, which is most important, is for tachycardia. Tachycardia is indicative of shock, fat emboli, and a pulmonary embolism.
So Danny will have surgery on his right leg, and he is being placed in skeletal traction, which is applied directly to the bone, and this should help prevent damage to the tissues near the fracture site. And it is designed to prevent movement at the fracture site as well, and it should help restore his bone fragments at the fracture site to their normal positions. Okay. This is symbolic of the type of traction Danny's leg would be in. This is the lower extremity. We know it's a femur shaft, so it's going to be up higher, but this is just symbolic of how it will work. So he's placed in a cast, or a pin is driven through the bone, and it is above or below the other one. So it will be pulled by this weight through gravity in order to bring the bones together properly.
When evaluating Danny's skeletal traction apparatus, it is important to ensure that his body is maintained in proper alignment to make sure that he's getting the optimal traction force. Next, we assess Danny's pin site dressing, and we notice that the site is dry but with some watery, serous drainage oozing from the site, which is slightly reddened. We would document these findings as normal. We have gathered our assessment data and are putting together a plan of care for Mr. Ellington. We've started off by developing these nursing diagnoses: risk for infection because of his open skin wound and introduction of an orthopedic pin through skeletal traction, acute pain due to his fractures and tissue damage, impaired skin integrity due to his open wounds, self-care deficit because due to his cast on his arm and leg he'll need help with hygiene, toileting, and eating. Risk for injury because of his cast that he's unfamiliar with. He has a risk for injury and falling. And risk for constipation due to immobility, which will decrease peristalsis and appetite.
Okay, while hanging Danny's IV Ancef, he asked us, what is this medicine for? What is Ancef for? And so we tell him that Ancef is an antibiotic to prevent infection, and what we're worried about is him developing osteomyelitis, which is an infection of bone tissue. Some signs and symptoms of osteomyelitis include fever, localized bone tenderness, localized swelling, and localized erythema. Currently, Danny is not experiencing any of these signs or symptoms.
Alright, so during our assessment of Danny's coccyx, heels, his toes on his right foot, and his fingers on his right hand, we noticed some of the impaired skin integrity. However, they were pale, warm, he had good capillary refill, which would be less than 3 seconds, and some swelling, especially in his hand. So we would intervene by elevating his hand on a pillow to decrease the swelling. 15 minutes later, after our intervention of the elevation of the hand, we noticed that the swelling had increased instead of decreased. So what we would do next is we would notify the physician immediately. Pallor, coolness, tingling, and sluggish capillary refill suggest inadequate arterial circulation to Danny's arm as well as his hand. These are classic signs of compartment syndrome. And compartment syndrome is inadequate arterial blood supply to the tissues secondary to severe inflammatory edema in a confined space. Immediate medical intervention is indicated! Exclamation point.
So the physician comes in to open the cast edges to relieve some pressure, and after he does that, the pressure is automatically relieved. His hands become pink and warm, and then he orders for him to perform PT exercises, which some of the exercises are quadricep setting exercises, which those are to improve the stability of his knees. And another one is ankle rotation exercises, and that's to decrease the risk of DVT, which is deep vein thrombosis. Danny is cooperative in performing his exercises. He's also cooperative in using his trapeze to lift his hips off the bed every 15 minutes to relieve pressure and adjust his position. He doesn't want to develop a pressure ulcer.
Fat emboli syndrome usually occurs within 24 to 72 hours of orthopedic injury. When assessing Danny for fat emboli, we're going to assess for mental changes and petechiae, which may appear on the upper chest and neck and in the axillary region.
So we've put in place these interventions in order to help Mr. Ellington get back on his feet. First, we have deep breathing exercises, and this will promote full lung expansion and help reduce the risk of atelectasis as well as pneumonia, which are respiratory complications associated with immobility. Next, we have a high-fiber diet. This will help stimulate intestinal motility and decrease Danny's risk for constipation while he is immobilized. Next, we have frequent examination of his skin. Due to him being on bed rest, this early detection system of skin pressure sites can help prevent pressure ulcers from occurring. Next, we have teaching about his treatment plan, because knowledge decreases anxiety and increases patient participation within his care. Last but not least is monitoring of his urinary elimination patterns. Danny is at risk for urinary stasis and kidney stones, caliculi, secondary to his immobility. Incomplete bladder emptying can cause urinary stasis. Stagnant urine is predisposed to harboring bacteria that can cause a UTI. And all of these are appropriate for Mr. Ellington. Danny's fractured femur is surgically repaired with an intramedullary nail, also known as an internal fixation. A long leg cast is also applied. This will allow Danny to leave the hospital and be cared for at his home.
Danny receives patient education on how to provide optimal arterial blood supply and venous blood return to minimize the swelling. Elevating Danny's casted leg on one pillow would encourage venous blood return without interfering with arterial blood supply. This position would also help to prevent the swelling.
Danny is discharged. A home care nurse has been assigned to facilitate Danny's transition into his home environment. A hospital bed with a trapeze awaits Danny at home. His friends and family all plan to work together with Danny in his recovery.
This has been a patient review from HESI Case Studies 2014.
There it goes.
Is it working?
It's doing the beeping thing now.
Yay!
Alright, go sit over there, it's recording.
Okay.
Hello.
Need to report bright red blood or thick yellow drainage at the site, which would be indicative of infection or too much bleeding.
Currently, Danny is not experiencing any of these signs or symptoms.
15 minutes.
Okay.
Stop. Our initial intervention, and his hand had even got, no, it's stupid. He'd even gotten worse. That boy, that hand was so swollen, it was worse than before. I tell you, we need to get the doc in here because this ain't working, I'll tell you. Get him on some fluid overload digestion crap.
Are you recording this?
Yeah.
Cooperative in performing these exercises.
Hold on. Okay, start over with that.
Danny's cooperative with. You threw me off, man.
Just do it again.
Okay.
The pelvis or long bones such as the femur.
Leave the hospital and be cared for at his home.
Danny receives patient education on how to provide optimal arterial blood supply and venous blood return and minimize swelling. Why y'all laughing? What happened?